All right. Hello, everyone, and welcome to today's live stream on analyzing public health data with the Elastic Stack. Today, we're happy to welcome Sean Collier, who's the Vice President of Engineering at Night Shift Development. I'll hand things over to Sean. We're super excited to have you here today and looking forward to the presentation.
Thanks, Faith. Yeah, we're really excited to be working with Elastic and excited for the talk today. As Faith said, my name is Sean Collier. I'm VP of Engineering here at Night Shift Development, where we do a range of data analysis, analytics, engineering, science activities, and we produce a product called ClearQuery. Today, I'm going to talk a little bit about public health data and how we can use Elastic Stack to look at that and provide meaningful insights to each and every one of us. This will be relatively informal. We'll have question time at the end, but if anybody has any questions, feel free to blurt those out as we go along. If they're relevant to a particular slide, happy to answer those in the middle. Otherwise, we'll have time at the end. So, thanks all. So before we actually kind of dive into the data, wanted to talk for a minute about what some of my interest was in looking at some of the data here. And to do that, we have to kind of back up a step and have a quick story here where I really like auctions. We'll get to data in a minute, I promise. I think auctions are just generally very interesting. And, my wife and I end up spending a lot of time looking at auctions to find various things we need. And I was on looking through a local auction site and saw this pop up pretty recently. And it was, literally hundreds of temperature scanners pop up for auction, essentially a fire sale, if you will. And it made me question, like, oh man, I didn't even see these things until, except for the past year. And now, there's so many that we're having this kind of fire sale scenario. So the world is just changing so quickly. The technology is changing. The tools we're using are changing. And it made me kind of want to be like, let's back up a step and see how the world has changed from a data perspective. And, what does that mean for me and my life and the decisions I make and moving forward. And so, this kind of started me on a journey of looking at some of the interesting things. I do want to caveat any of the data and things we're talking about here are mostly questions that I found interesting. But what I hope to get across is how you can use this sort of process and approach for questions that you may find interesting. So that doesn't necessarily mean we're going to have super interesting, major breakthrough public policy sort of data decisions coming out of this presentation, but rather how can you find value in the things that you're interested in and how can you help make better decisions. I'm fully aware that there are things I'm not going to talk about that are very important. 2020 and 2021 have been unprecedented times in terms of public health policy and medical and cultural implications too. And also that hindsight is 2020, right? We're looking at data that's from the past, and so it's not reasonable for us to necessarily say, oh, we should have done this thing at this time, because that's not really the intent of this particular presentation. Not to say that data shouldn't impact those things, but let's look at some of the questions. So, for me, one of the ones that was very interesting was thinking about this concept of flattening the curve. So that was a term we heard a lot at the beginning of the pandemic. And the concept was when you have a pandemic where people can get very ill very quickly, you can overwhelm the medical system. And there definitely were instances of that happening, especially early on in the pandemic, where we weren't necessarily sure how to treat people, what their, complications may be. There was just so many open questions, but we heard a lot about flattening the curve. And so that was one of the things I was initially interested in looking at. And so the kind of the baseline question there might be something like this, which is how many hospital beds were used on average over time in 2020? So I'll let the reader think about that for a second. You can think about, okay, well, how many beds? It's a good question. And the first answer I got was negative 9,373,689, which seems like it's probably not going to be right. And I don't think that passes the sniff test because I'm going to assume we don't have negative beds in use at any given time. And so that was kind of my initial, sign here that this might be more challenging than I initially thought, because I know there's been a ton of data collected. So how can it be that there's a ton of data collected, but at the same time, I'm getting these really crazy results just looking at some of the data sets? And so your initial question may be like, where are you getting this data from? How is this data any good? And this is the official data from HHS. They have visualization tools. This is a snapshot from their visualization tools showing okay, if I want to look at adult hospital bed usage on a 7-day average, which is like a rolling weekly average, and I want to see that by week, I can see on my axis here that these values are all negative. They're bouncing around. And so what's happening here? And pretty quickly, when you look at their data set, you realize, oh, what they've done is something that's actually very valuable. They said, okay, we want to protect people's privacy. So given that we're collecting data from all sorts of hospitals and all sorts of medical centers from across the country, if there's a very small number, so from 0 to 4, of usage during that time, we want to anonymize that data essentially. So what they did in these cases was said, okay, we're going to replace the true number with a negative 99999 number. Well, pretty quickly, you don't need very many negative 9999999s before you really throw off the actual data. And so I realized, okay, this is going to be an interesting data engineering problem. I can't actually collect the data I want without first processing it and then analyzing it. So the visualization step is kind of missing a processing step here. I also saw that in our tool, ClearQuery, where I was looking at buckets of the data, and I saw the same thing here. I saw a bunch of buckets of data that were in the negative 9999999 here, confirming what I had already seen. And so what I ended up doing was essentially changing that number so that we could say, okay, well, let's assume that in those cases, we have a different value there. And so that negative 9999 can essentially be minimized in the impact there. So then once we do that, we can start to get some very interesting things data-wise from looking at this data. So I'll walk you through what's happening here. This is a dashboard put together in Kibana based on that data set from HHS. So HHS provides us with a great foundation, but we need to do a little bit of data engineering because, as mentioned, we had this anonymization. I won't call it a problem because I think it's actually a benefit of the value, or excuse me, the benefit of the data that it wants to protect individuals. But so it has this attribute, which is that it's going to be hard for us to process this and run any sort of aggregation or graphing or visualizations when we have that negative 99999 problem. So once we do that, we can actually start to see, oh, now we get some really interesting numbers. So on the right-hand side, we see hospital bed utilization over time. And on the left, we see hospital admissions for COVID-19 over time. The one thing I do want to caveat here is that you'll note that this data starts, kind of in the late summer of 2020, at which point we've already gone through, some of the steps of the pandemic. One of the things I found in looking at this data was there's a lot of good data, but there's not necessarily good data throughout. So this data set was actually very good, but doesn't start until a little bit later in the pandemic. At the end of the presentation, I'll put out a link to the different data sets I've used. So if anybody is interested, they can take a look at this as well, excuse me. But what you start to see here is that, much like most of the country, that at the end of 2020 and early 2021, we had a large spike in COVID-19 admissions over time. And what we can see on the right is that even in New York, which has been known to be hotspots kind of at different times in this pandemic, that what we see is that we didn't actually necessarily hit hospital bed utilization. But one of the things that I really appreciate about a data, engineering exploration is that you realize after looking at this data that there could be, a lot of explanations there, right? So your initial thought is, okay, everything looks good. But what if, hospital bed utilization isn't necessarily actually the right metric? Because suppose you're getting a lot of hospital admissions, but each person, instead of getting necessarily the care they were getting, is kind of getting rushed in and out because so many people are coming in. That's not something that's tracked super well on this data. So that's actually one of the things I want to do kind of follow-up research on. But my initial pass here is like, oh, flattening the curve looks pretty good. But there's a lot of caveats there. The way we treat COVID-19 has changed significantly over time. So if I had actually been able to get the data back to March, I think it actually would be, perhaps even more interesting to look at this. Give me 1 second here. Yeah, one of the other things I wanted to call out here is, in addition to Kibana looking at this data and ClearQuery running on the same data set, we start to see a lot of the same sorts of things, but we can see some significant changes at the bottom, which I think is really interesting to call out some insights there. Changing directions a little bit, I think one of the questions throughout the pandemic has been consistently, what should we do right now? The situation continues to evolve. And I don't mean that necessarily just in the past either, right? I think part of the reason I wanted to have this, this talk at this point in time, in June of 2021, is because the COVID pandemic has been going on for a long time, but also, what are the implications moving forward? And, what should I do as an individual, as a result of that? And I think that's really interesting here. This is getting away from that kind of retrospective sort of view and like moving forward, what should we do? So this has been, I think, the question, for the past years, what should we do right now? And I think it continues to be an incredibly important question. So let's take a look. Let's take a look at a couple of different aspects there. So one of them is, vaccinations. I think vaccinations or vaccinating in general has proved to be an incredibly effective tool for, minimizing the case count of COVID-19. This was one of the data points that I was looking at that just, it's kind of a feel-good story in many ways of, I wanted to leave the time scale here at a year. So a year ago, we weren't even close to having, COVID vaccines available. We knew it was on the horizon. And then we start to see, near the end of 2020, that it starts to pick up. And what this graph is this is a national graph of total administered vaccines. This is for both, first and second shot where that's applicable. So you could look at the side and see, okay, well, 300 million, that would be everybody, but this is counts both first and second doses here. But this is one that just gave me a lot of optimism. I mean, I think in many ways we're starting to see the impact of this. And I think in times where there's a lot of challenge, and it's been a very challenging year, I think there's a lot of value in looking at things that, seem to be going relatively well. I'm not going to, dive into all the nuances of the vaccines and, where this chart goes from here and all these sorts of things. I think there's actually a lot of other data sites that have that sort of information. And I don't know that it's necessarily super specific to the kind of data that I was looking at, but it is one that I kept coming across, the impact of vaccines is very real on a lot of these other graphs. And so it was one that I did want to talk about for a minute and will impact, the kind of dashboard that I'm working to put together here. These different Kibana charts we'll see at the end kind of come together to form a little bit of what I think of as a cohesive view. Same view again. I wanted to talk for a minute about small business. So I live in Virginia. And so, Virginia was of particular interest, but one of the things I am trying to get across in this presentation is that the value of the data is that we can really zoom in on a close level and see things that are impact for your specific scenario. So I looked at this in addition to the state level, I looked at this at the county level. The county level, it gets a little bit harder to look at some of this data just because it's not as well recorded. This data is coming from Track the Recovery, which is a great project run by Opportunity Insights, which is a lab running out of Harvard, where they're collecting data from a number of places for things like unemployment and how spending is going in small businesses. And small businesses here, just for understanding, are as classified by the SBA. So generally these are the limits on those are in the couple hundred people range. But what you see very clearly both in Virginia and nationally, and I think in most states, is that at least the states that I checked, they help pretty much mirror this pattern, is that small business across the board is just really farther down than I had expected, to be honest. This is one of the, to me, the most interesting insights of my digging here was that small business has been very negatively impacted and continues to be negatively impacted. If you look at so kind of the reverse side of this of spending, that people's spending habits haven't slowed down as much, and in many cases actually have picked up. But the small businesses have really suffered. So for me as an individual, this is a very good data point to remind myself, say, hey, how can I be a good member of my community, and support small businesses, support particularly ones that have really struggled. The line at the very bottom here, which I think is probably no surprise to anyone, is the food and accommodations industry. So I think I think it's worth calling out. I think as the vaccines are really perhaps a positive story, I think the suffering of small business is a real real potential downside of this entire situation here. So that's a good reminder for me. I think I'm going to not try not to tell too many kind of narrative stories around these things, because I think it's good to look at the different data views individually and kind of like take an individual assessment from them. But this one, it was surprising to me in the magnitude of the impact from COVID-19 pandemic. One that I think it was particularly interesting to me was agriculture. So we have a small family farm, and so this is what I mean by things that are of particular interest to me and my problems. How do I look at them? Agriculture is a very interesting industry to look at from, in general. But I think in COVID-19, it's been, impacted in a lot of ways. And I think we heard about that early on here. And I'll go to this slide here for a second, which is, this is national cattle processing. Again, we can look at how we can slice this by state and all this sort of thing, but this is at the national level. And I think, cattle processing is a big part of the agricultural economy. And so I'm using it here kind of as a proxy for, some of the agricultural industry at large, which was, unsurprisingly, people have needed to eat throughout the entire pandemic. I don't think there's any surprise there, but I do, note that we've had some pretty significant dips, particularly in early last year, where this is kind of the April-May timeframe, where there was, a number of hotspot outbreaks, and what have been the kind of knock-on implications there. And this is where I think it gets to be interesting at looking at like kind of the national level versus the state or more local level. So for me, again, just using Virginia as an example, because I live in Virginia, you see that actually Virginia is not a major cattle processing facility, or major cattle processing state. But at that same time where there's a national shortage, you see actually Virginia starts to process more, which I thought was very interesting and mirrors some of the things that you hear when you hear anecdotes around, the sort of, logistical challenges that COVID-19 has impacted on the agricultural industry. So I think that is an example of one type of lens that you could take at looking at this that is, both specific to myself, but also, I think has larger implications. And I think that's a good way to look at using data in situations like this. So, yeah, we've talked about kind of a few different particular aspects and different places, and but what I wanted to do now is kind of like tie this all together. So, we have some of these trends and some of these things. So how do we start to look at that together? And this is where I think you really get some of the interesting value from using tools like Elasticsearch and Kibana to analyze this data. So here's a snapshot of the Kibana dashboard that I've built throughout this time to show kind of the different aspects of this as it's going. So you've seen the different snapshots here, but what's really compelling in my mind about this is that I can actually zoom in on the state level, as we see in the upper left-hand side, where this is for New York. And you can also, in many cases, zoom in at the city level. So you can see, okay, well, how can I, rather than New York at large, how is, New York City or, Albany or Rochester, how are these other cities impacted by COVID? And you can take a look at that, which is what's really great about the level of data that is being collected by the HHS, the CDC, the Track the Recovery, which are the places we're getting our data source from. Again, just as noted earlier, you can see the small business impact, looks pretty similar in New York as it does in Virginia, which I think is, pretty similar trend across. And again, the total number of vaccines, is kind of a miniature version of what's happening in the whole country. So in many cases, the data of the states actually does look very similar to what the data looks like at the national level, but that's obviously not 100% rule. So here, again, just kind of looking at that same dashboard from the Virginia specific perspective. For me, that's of particular interest, but obviously, it's an extensible concept that I think provides a lot of value. Yeah, I did want to talk quickly about some of the kind of data engineering challenges. I think in looking at public data sets, there's not generally super good standards around how you do different things. You see these things like the dates. So in this top mess of a picture that I won't dwell on too much, this is a CSV of the state small business data. And it's a whole lot of small numbers that are a little bit hard to understand when you're just looking at them. But you also run into these interesting problems, like the first three columns of this are year, month, and day. So you have to do some pretty basic data engineering sort of exercises to combine these things to get the actual value. Similarly, the second blob down here is, okay, how do I actually swap out that negative 9999999 with a smaller value? In this case, I'm trying it at 2. I tried it at a few different values to see the impact there. But one of the things that I think you need to think about when you're looking at these data sets is the quality of the data and what tools you can use to kind of get a quick sense of that, and then also manipulate those. Because in many cases, even the very high quality data, which I'd say these cases are, they do need a little bit of massaging to get in there. But once you do that, relatively lightweight massaging, you end up with, very impressive, I would say, dashboards and graphs as a result of that. I say that primarily with the note that this is an obstacle that I think you'll face with a lot of public data sets, but shouldn't necessarily be totally overwhelming to, people looking to, grab these data sets, because I think that's going to be kind of a universal problem in this space. Yeah, the other thing that I'll talk about from a data perspective that is just like, one of those things you have to keep in mind. If you're used to using Elastic and Kibana for something like machine logs, where you're getting a high variability in the number of entries, a lot of times when you're looking at this sort of data, you're actually not going to get that much variability in the number of records for a given time. So in this case, for example, if a hospital has to report how many beds they've been using, and they have to report that on a weekly basis, you're basically going to get the same number of hits, because every week, every hospital has to do it, and there's not that much fluctuation in how many hospitals there are. And so it feeds really well into using the dashboards, but it can be hard to understand if you have really good data based on this. So you just have to be really cognizant about, hey, should I be looking at the number of hits? Should I be looking at particular data? And just being really aware of that, I think, is an important part of an exercise like this. Again, not terribly surprising, but just a good thing to keep in mind as you're running through it. Just quickly, from a very high level, what my process has been in getting these data sets, finding the data sets and then checking the data sets. I want to fully acknowledge, and I've tried a few times here, that the data here is largely very good, and it's coming from, a collection of federal and independent sites that I have listed at the end and have references to. But, doing this sort of data analysis in, a relatively small amount of time would be impossible without having the high quality data. So without a doubt, this sort of process and presentation depend very heavily on the upstream data. So just wanted to get that, very clear. The other thing I'll note is that, you want to make sure, in this case, I'm generally reporting at like a weekly level. So if my goal is to look at a dashboard at a weekly level and kind of use that sense, I want to try and make sure as many of my data sets are at weekly level there. In this case, I'm ingesting this data into Elasticsearch using ClearQuery. You could get it in any of this data into Elasticsearch in a variety of ways. I'm not going to talk too much about ClearQuery here, but it does, put this data, ingest this data directly into Elasticsearch, which is how we're then referencing that in Kibana. And then I'm using Kibana for kind of that follow-up dashboard and deep dive look as well. One of the things, if you're at all inspired by what I've been talking about, some additional, things that you could look at are listed here. One of the things I love personally about doing exploration like this is that as you're going through the process, it starts adding more questions. So I probably have more questions having spent hours on this than I would have had, spending no time, which almost seems counterintuitive because you think you start off with the questions, but in fact, I find that the questions have been multiplying and that there's a lot of really interesting follow-up one could do. I think I'm not going to run through all of these right now just because there's a handful, but I do think it's a really good mental exercise to kind of jog of like, what are those next level effects of something like a pandemic from both the medical and the societal implications. And I think as I've gone through this, I've just started trying to predict what I think these answers will look like. And in some cases, I've started to get some, but not enough to show here today. And I think these are really fun exercises for people to keep thinking about. But yeah, in terms of takeaways, again, I'm not aiming to have an overarching hypothesis about COVID or the reaction to it or anything. But these were kind of the points that stood out for me. Small businesses really are still hurting in a big way. COVID-19 is a really big deal. Pretty much every metric I looked at, regardless of how closely tied it was, for example, the agricultural data isn't necessarily something you'd think would be hugely impacted by, like a pandemic, but it is. People still need to eat, but that sort of supply chain is still very much impacted because it's driven by people who have an impact from or are individually impacted by the pandemic. And the last thing is, when I find a good data set, it's good to be grateful and thankful for all of that hard work upstream. As you're pouring through thousands of rows of all this data, people have to be collecting that and giving that to you, and that is a very difficult task. And then turning it into the processing is a whole separate task, and that was really the focus here today. Almost at the end, just kind of last thing here is, I think it's also always worth asking of like, what is the value of this type of assessment? For me, I like to think about it like this, which is that data can drive our understanding of the world, but data can also be really challenging. And so you have to really focus on what are the questions that I, as an individual, want to do. There are many COVID dashboards out there, and many of them are very good. Many of them have state-level views on things. I think what's really nice about the dashboard that I've been working to is that it helps me have a better appreciation for the entire process, but also that I can view the range of metrics, whether those are societal things or economic or medical. Like I can look at those at the range that I would like to. In some ways, it also can be a little bit cathartic. I think it's worth calling out here. I was surprised how much going through this was just a good exercise for me, and like thinking about from that process that I started at the beginning of seeing an auction and saying, what's happening in the world that we're now auctioning these things off. I think it can help give appreciation for what's happening. And the last thing I'll say is really I try not to extrapolate or narrate too much, because I find that when I start to do that, it kind of blinds me a little bit. And so instead, what I try to do is ask more of those questions and try and get a deeper understanding. And I think that's where a lot of the previous slide came up of, hey, these are additional things that I would like to look into that I think are just generally compelling. So if anybody has any questions, feel free to ask them here or reach out. I'm Sean at clearquery.io. I also have posted this, both the presentation, the content of the slides, and the data sets that I've been using to GitHub. Just wanted to put these references out here. These are the main data sets or collections of data sets that I was using. Wanted to get these on the record out there and being very much appreciative for what they are. Any questions before we wrap up?
While we're waiting for questions, Sean, thank you so much. That was awesome. I definitely feel very inspired and curious after your presentation. Based on my own Netflix consumption, I expected there to be a huge surge in subscribers. And after a quick Google search, it seems that there was an initial surge, but that things slowed down dramatically as the pandemic wore on. But I would love to, if there's anybody listening who feels as inspired by this presentation as I was, but has a little bit more technical knowledge and wants to apply what we learned today. Please let me know if you would like to do a presentation specifically on Netflix subscribership, because I would love to see it. Yeah, but thanks again, Sean. That was really cool.
Thanks.
Awesome. Oh, we got a question in. How much data did you collect roughly, and or how big were your indices?
Yeah, it's a good question. In terms of big data, which I think is thrown around a lot, I'd say these are actually generally relatively small data sets. So most of these are in the hundreds of megs, maybe a couple were in the gigs level, relatively small data sets. And that happens for a few reasons. One is a lot of this data is already synthesized down to like a weekly abstraction or a daily abstraction. And the daily abstraction, if you break it up, for example, by states or by county, you're talking about, thousands of rows times days. So you're talking about, hundreds of thousands of entries for any given, value. So compared to, very large data sets or, huge machine generated sort of things, this data sets were relatively small.
I definitely have seen a lot of dashboards and data related to COVID floating around out there. So good question, Martin.
Yeah, I will just elaborate there one more time. I did think it's very interesting looking at this is that, I was doing a survey and trying to actually just find the largest data sets. And, just a lot of them are not necessarily large in how we would think about how this data set. And it surprised me initially, but yeah, I just realized that, the scale that they're operating at, it kind of makes sense. But I also was a little bit surprised that there wasn't larger data sets. But then after thinking about it a little bit, it makes sense.
Totally. I feel like data collection in any context is always a challenge. So thinking about scaling globally and collating from so many different organizations, governments, etc., certainly was a huge challenge in the pandemic. I remember at the beginning, I just had the Johns Hopkins COVID-19 tracking dashboard, just like open constantly, refreshing it. And yeah, super interesting stuff. Cool. Well, if we don't have any other questions, Sean, thank you again for your time. And folks, just so that you know, you can look at one of the live stream comments here with a link to Sean's GitHub, which has the resources for this presentation. Oh, of course, the age-old question dance. As soon as I try to wrap things up, we get another one. So did you find any outliers in the data sets that you had to eliminate, Sean?
Yeah, I mean, the obvious ones were the -99999s. Those were relatively easy to target. But I did notice that even after that, there were still cases of, negative bed reporting in some cases. So, that's really hard for me to know what exactly that is. So it's like, is a hospital accidentally in some cases putting in a negative number? Like, is it somebody fat fingering a case, or is there some other problem there? And, so there were other cases. The most obvious were negative scenarios. I didn't have any scenarios where it was like way too many zeros, where somebody all of a sudden said, hey, we used 1 million beds, even though we only have 1,000 beds, for example. Like I didn't run into scenarios like that. But there were a few that I was not able to track down the reason behind, but was able to clean up because, they stood out as fairly obvious issues, because you can't use negative beds, at least the way we're counting them. You can't use negative beds in a hospital. And so, there were a few, but for the most part, the data was generally pretty good, but certainly not good.
Awesome. Thanks for the question, Dafuster. Great. Well, thank you again, Sean. This was super interesting and really informative. So thank you so much for shedding some light on this for us. And thanks everybody for joining in. Hope you have a good evening,
Thanks
day, afternoon. Bye.